Hello and good afternoon, everyone. My name is Franklin. I am one of the two co-founders of the Northern California Spinal Cord Injury Foundation. And welcome to tonight's presentation on diabetes management with consideration for those with spinal cord injuries. I'm happy to see Shelley Wood, our registered dietitian nutritionist from Santa Clara Valley Medical Center, back again to address this often sort of misunderstood topic, and I'm sure she's going to shed a lot of light on it, which if anyone can, she is the person to do it. So a few ground rules as always. Everyone has been muted in order to eliminate any background distractions. So we will have a Q&A session once Shelley has completed her presentation. So you can feed me those questions through the chat feature on your Zoom screen. We are recording this presentation. As always, we will make it available to everyone who registered. It'll be in your inboxes tomorrow morning once you log in. And finally, as always, these presentations are made possible through donations from our generous donors, which we are grateful to, who continue to support us. That allows us to make presentations like this possible. So without further ado, let me jump into introducing Shelley. Again, the topic is diabetes management with consideration for those with spinal cord injuries. Shelley has been a lifelong advocate of nutrition. When she isn't working with her patients, she can be found in her greenhouse or kitchen. She obtained her Bachelor of Science degree in National Science from my alma mater, San Jose State University, in 2012, and she also obtained her master's degree in public health in 2016 from the University of New England. She has been working at Santa Clara Valley Medical Center here in San Jose, one of the top spinal cord injury rehab hospitals in the country since 2013, where she currently works in the outpatient clinic of the hospital, seeing primarily those with spinal cord injuries, and she also spends time working with complex GI issues in the outpatient gastroenterology clinic. And also, for full transparency, Shelley is a member of our of NorCal SCI's advisory board, which we always lean on for great advice, and including our ability to make presentations like tonight's possible. So welcome again, Shelley. Thank you for doing this, and please take it away.
Thank you, Franklin. Happy to be here, and glad to see everybody on tonight. Not the most fun topic. I love presenting with Arash and sharing our foodie tricks and that kind of thing. But this is a really important topic, and it's one that I'm glad that that I've got an audience here for, and I'm hoping that will become a useful source of information for you for questions about diabetes, for those who have been diagnosed with it, as well as for those who are concerned perhaps or want to learn a little bit more about it. So I'm assuming everybody can see my screen. So we're going to talk about diabetes tonight. I'm going to sprinkle in whatever pertains to spinal cord injury as I can, but again, with many of the things that I talk about, much of the bulk of the research is based on the able-bodied population. But that being said, with the inherent risks that are associated with having a spinal cord injury and the risk for having metabolic disorders, especially cardiovascular disease, which is probably the most dangerous and the worst one. Diabetes falls right under that umbrella. And so the typical advice for the able-bodied population, it can be very useful for those with spinal cord injuries. So tonight, I'm going to talk about statistics because I do lean heavily on the science and the research and what's going on with diabetes and everything else that I talk about. But we'll chat about statistics. We're going to go over risk factors for getting diagnosed with diabetes, understanding what it is, everyday management. We'll talk about the different ways that blood sugar can go awry, talk about sick days, and then I'm going to talk to you about things that you can do with your nutrition to better manage diabetes if you have it, or avoid getting it altogether if you fall in as one of those that would be, under the risk factor umbrella there. And you'll see when I'm talking about it what I mean. Statistics overall. a lot of people have been diagnosed with diabetes. So in 2018, 34.2 million adult Americans, which is roughly 10.5% of the US population, had diabetes. That's a huge number. Out of the 34.2 million adults, 26.8 were diagnosed with an actual diagnosis, and 7.3 million were undiagnosed. So there are people walking around with diabetes that don't even know it. 26.8% of adults over the age of 65 had diabetes. So as you get older, your risk goes up. And 1.5 million Americans are diagnosed each year, 1.5 million. 88 million adult Americans had pre-diabetes that year. I am going to take a guess, but I'm thinking that last year probably resulted in some much higher statistics, and we'll find out in another year or two if that's true, but that's pretty unfortunate, but I'm thinking that we're going to end up seeing some spikes in diagnosis. Breakdown, so it does run along the lines of different ethnicities, with the Hispanic, non-Hispanic, Black, and American Indian and Alaskan Native being the most hardest hit. There are a variety of reasons why that would be, but those particular ethnicities are much more at risk. Much of it has to do with food and availability of food and food deserts and a lot of demographic information. So unfortunately, if you are any of those, your risk is automatically going to be higher for having a diagnosis. The cost of diabetes in the US is pretty staggering. Total cost is $327 billion. We hear that word billion a lot right now with politics, but in looking at it from a medical perspective, that's a huge number to be spending on this disease. Direct medical costs are $237 billion. Reduced productivity, meaning loss of work, people calling in sick because of their diabetes complications, that kind of thing, is $90 billion in the US. Average cost of medical care for those diagnosed with diabetes is 2.3 times higher than in those without this diagnosis. And I do know that medical cost for those who have spinal cord injuries is much higher, obviously. And then you layer over that a diagnosis for diabetes, and now you're looking at a really, really high medical cost. The prevalence of diabetes in those with spinal cord injury, this is again very difficult. It's hard to find current statistics, but the prevalence of those with spinal cord injuries also having diabetes is probably a whole lot higher. The general consensus from what we know is that 13 to 22% of those with spinal cord injuries have diabetes. I need to fix my screen, okay. Many disorders that are related to age in the general population, like carbohydrate intolerance, insulin resistance, lipid abnormalities, and heart disease, are thought to occur prematurely and at a higher prevalence in persons with spinal cord injuries. The disorders, they're likely to be related to metabolic changes that happen, changes in body composition that result from paralysis, obesity, loss of lean tissue from denervation, and then greater adiposity above and below the level of neurologic injury. Adiposity is fat in the middle around your organs. So the bottom line here is the risk for diabetes is greater for those with spinal cord injuries. For pre-diabetes, the risk factors for pre-diabetes and diabetes are pretty similar, but basically you're at risk, and I'll talk more about what pre-diabetes is in a second, but you're at risk for pre-diabetes if you're overweight, if you're over 30 or over 45 years, if you have a parent or a sibling with type 2 diabetes. So this is a big one, actually. I should put this one on the top. Genetics plays a huge role in whether or not your risk is higher of getting diabetes. So if you have a parent, a sibling, someone in your immediate family with diabetes, type 2 diabetes, or type 1, actually, your chances of getting it are a lot higher. If you're physically active less than 3 times per week, so there it is right there with spinal cord injury. Have you ever had gestational diabetes? So Those who've had babies before and have had gestational diabetes, which usually is resolved once you have your baby, your chance of getting type 2 diabetes after that baby's born is much higher, unfortunately. And again, if you're African American, Hispanic, Latino American, American Indian, Alaska Native, even some Pacific Islanders and Asian Americans are also at a higher risk. That puts you at a higher risk for having diabetes. I do want to say, pre-diabetes, if you have a pre-diabetes diagnosis, it's preventable. Actually, it's reversible with simple lifestyle changes like losing weight if you're overweight or eating healthier. Any kind of physical activity that you can do. When you talk to your therapist, anything you can do, upper body strength, whatever you can do, it's also advisable just to move your body however you can. And being at a healthier weight and eating healthy, that pretty much reverses that pre-diabetes if you take care of yourself in that way. A lot of people, I've seen a lot of patients riding that line for pre-diabetes have been able to back away from it, thankfully. So this is the same as with pre-diabetes, but this is worsening glycemic control. This is like when you kind of go over the hill, and from pre-diabetes to type 1, your risk is obviously family history. Again, with the family history, very, very important to know your age. So type 1 diabetes is, age matters there, but type 1 diabetes is interesting. It can present at any age, but it's more likely if you're a child, teen, or young adult. That's usually when the diagnosis happens with type 1. Type 2 this is the common one. This is the one I talk about when I talk about statistics in the US. This is the common one. This has to do with lifestyle factors like eating and things like that. But your risk factors are very similar to the pre-diabetes. Obviously, you're more at risk for type 2 if you have pre-diabetes, and then overweight, your age again, your genetics, physically active, gestational diabetes, and again, certain ethnicities, definitely at higher risk. This is what happens if glycemic control gets worse. That's when you get diagnosed. So how is it diagnosed? Usually there's 2 tests that you will get. One is the glycated hemoglobin A1C test. The test indicates your average blood sugar level for the last 2 or 3 months. Below 5.7 is normal, no diabetes. If it's between 5.7 and 6.4, you're pre-diabetic. And if it's over 6.5 on 2 separate tests, it's diabetes. And then there's the other test, fasting blood sugar, where blood's taken after you fast all night long. So if you fast all night, they draw your blood, take a look at your blood sugar. If it's less than 100, then it's normal. It should be below 100. If it's above 100 to 125, that's pre-diabetes. And then over 126 on 2 separate tests, just to verify, that's diabetes. Most of my patients have had the A1C and the fasting blood test a couple of times, and then they're diagnosed with actual diabetes or pre-diabetes. So let's go backwards now. I've talked about statistics, risk factors. I've talked about the actual diagnosis and like how you would be told if you have pre or actual diabetes. Let's talk about what's diabetes. This is very important to know. A lot of my patients, when they come to me for education, I ask them first thing, do you even know what diabetes is? And the majority of them say, yeah, something to do with my blood sugar is high or something like that. Yes, correct. But there is more to it. And I think it's important to understand what it actually is, because when you understand something, you're better able to work with that and make choices based on that. So knowing what it is important. So your body has to have some sugar. That sugar is called glucose. It has to have sugar in the blood. This is the simplest form of carbohydrate, glucose, and it's the body's preferred source of fuel. It's what it uses. Diabetes is a condition where there's too much sugar or glucose in the blood. And we can tell there's too much sugar in the blood from the blood tests I just mentioned, the A1C and the fasting blood glucose. When sugar's in the blood, usually it travels to the cells where it's burned as energy once it gets in the cells. Your body needs this fuel in the cells to survive. And in order to get into the cells, your body needs a key. And that key is called insulin. Insulin is made by beta cells in your pancreas. So when you have diabetes, the blood sugar level is too high, either because the pancreas is not making enough insulin, that key, to allow the sugar to get into the cells, or the insulin is being made, it's not working correctly. Sometimes it's both. Sometimes it's a combination that the pancreas is not producing enough insulin. Sometimes the insulin's not doing its job. It's not working correctly. So that is precisely what diabetes is in a very laid back version. So the types of diabetes, we'll talk about type 1. So this is where the pancreas stops making insulin completely. This is type 1. This is the childhood one that when you think of childhood diabetes, type 1, pancreas is done, stops making insulin totally, has to have injections for the rest of their life, forever. Let's see, they need it for life. The insulin taken usually works very well to control blood sugar levels. So type 1s, they learn how to manage. A lot of them have pumps and things like that too, that help them manage their blood sugar levels well. And it's definitely a reasonable disease once you get the hang of it and you know what to eat and you have the right insulin dosage, everything is fine. In type 2 diabetes, the body may or may not make that insulin the key, but in either case, the body doesn't use the insulin effectively. So this is called insulin resistance. So the pancreas makes insulin, but it's not used right. So that's insulin resistance. With type 2 diabetes, a person might be able to take pills to help the body's own insulin work better. So metformin would be one of those, helping the body make insulin better, make it like more useful. He or she may also need to take insulin if the body's not making enough of it. So some people with type 2 diabetes might be able to keep their blood sugar levels within target range with only appropriate diet and exercise. About 90% of those with diabetes have type 2. That's the more common one. So sometimes there's no signs. This is the scary part. So this is why I talk about risk factors. And if you're thinking to yourself, both my parents had diabetes, I have a couple siblings with diabetes. This is something you need to think about if you haven't been diagnosed with it, because sometimes there's no sign. You can't tell. If you have a strong family history of diabetes or one or more of the risk factors that I mentioned earlier, you should probably discuss regular monitoring. I like to say maybe every 6 months, get those blood sugar tests done, talk to your doctor, be on the safe side if you fall within any of those. So common signs, frequent urination. So when your blood sugar is really high for a long period of time, the body tries to get rid of it through your kidneys. And for those who have intermittent catheterization program, ICP, you probably want to measure your output. If you notice that you feel like you're producing more output, you definitely want to measure it, talk to your doctor. Same with the suprapubic tube, probably want to measure the amount of urine you're producing, because if your blood sugar is high, your body's trying to get rid of it through urine, your output's going to go up for sure. And then increased thirst is another common sign, and that's because your body is trying to get rid of the sugar through the urine, so you're going to get thirsty. Increased hunger is another one, and a lot of people don't even realize when blood sugar is high for a long time, the glucose or sugar from the blood, it can't enter into the cells to be turned into energy. Remember, the glucose is the body's primary source of energy or fuel, and this can cause a really high hunger level, sometimes really high. I have a lot of patients with new diagnoses, and they talk about how ravenous they were right before their diagnosis. This is why. Changes in vision, slow healing wounds, those are two other signs of diabetes. Prolonged elevated sugar can damage blood vessels all over your body, but specifically it can block tiny blood vessels that go into your retina and your eye and disturb your vision. Narrowing blood vessels can impair wound healing because less oxygen is being transported to the wounds, which is necessary for healing. So that if you have wounds and you have diabetes, that blood sugar is really, really important. It's important to get that controlled so that way your wounds can heal. So complications, there's a couple of complications when you have diabetes or even before you've been diagnosed. One is high blood sugar, or it's called hyperglycemia. This is where blood sugar is high, too much sugar in the blood. As mentioned, signs are the thirst, frequent urination, hunger, dry skin or dry mouth, slow wound healing, those kinds of things. Occasionally, people with hyperglycemia feel tired, nauseous, maybe have a headache. If blood sugar is consistently higher than your normal range, if you have a range, your doctor will tell you what that is, generally over 200. If it stays that high, changes might need to be made to your medication and your diet, the two together. If it continues further, make sure you work with your doctor, because prolonged blood sugar above 200 is considered hyperglycemic, and that can be a big problem. One thing is especially important to know is illness and infection can cause high blood pressure or high blood sugar. So if you're sick, if you have an infection, that kind of thing, that can cause hyperglycemia. Stress from illness and infection creates the liver to release extra sugar into your blood. So when you're sick, the liver will release sugar. You can have high blood sugar, and it can get really dangerous. Day-to-day stress, even if you're stressed every day, that can cause high blood sugar. Carbs in certain foods will raise blood sugar. So if your blood sugar is really high before eating, if you check it, try to eat fewer carbohydrates than you normally would. I'll talk about that in a minute. To prevent it, just make sure you take your medications exactly as prescribed if you're on them, and then follow a healthy diet, which I will talk about. The opposite is hypoglycemia, low blood sugar. Low blood sugar is not good for the body. It can be really dangerous. Hypoglycemia is defined as blood sugar below 70. That's 70 milligrams per deciliter. Common signs of low blood sugar is sweating, shakiness, confusion, hunger, tiredness or weakness, and headaches. They vary from person to person. Some people don't even have symptoms at all, which is really scary. So if you check your blood sugar, just do it regularly, especially if it tends to drop. If you notice any of the symptoms that I just mentioned or feel strange at all, check your blood. Just anytime you feel weird, check your blood sugar. Low blood sugar is caused when there's more insulin in the blood than is needed to balance out the sugar. This can be caused with too much of certain medications, maybe, and adjustments made or something like that. Not enough food, so skipping or delaying meals, or if you're working harder with a therapist, greater than normal physical activity, that kind of thing. Kidney disease can cause low blood sugar. So the one thing that you should know if you feel like your blood sugar goes down sometimes is the rule of 15. So bookmark this, learn about this. It's the rule of 15. It's very important to know. If your blood sugar is less than 70, you're going to drink 15 grams of quick carbs. And quick carbs might be like half a cup of fruit juice or regular soda. This is the only time I'm ever going to recommend drinking these things. A tube of glucose gel, 5 pieces of candy, 10 jelly beans, that kind of thing. So if your blood sugar is under 70, you take 15 grams of these quick carbs, you wait 15 minutes, then you check it again. If it's still under 70, you do the same thing again to have more of 15 grams of quick carbs, wait 15 minutes, check it again until it's above 70. So that's the rule of 15. In extreme cases, it's possible to become unconscious. So if you experience hypoglycemia often, probably want to get a prescription for a glucagon kit. Glucagon's a hormone that's given by an injection, which tells the liver to release stored glucose or sugar into the bloodstream. It's a prescription. It's very fast acting. So it's something that maybe your caregiver or family member with you would be trained in. If you need to use this, you're going to want to eat something immediately after. As soon as you get your wits about you, you're going to want to eat something right away, because the sugar from your liver might not last long and you could drop again really quick. So as soon as you use this kit, you eat. So that is hypoglycemia, and that is pretty dangerous. I've seen some pretty nasty things happen with hypoglycemia. Sick days, this is another one. Blood sugar is really hard to control when you're sick. Usually it's high. Most usually I see it go sky high. So if you're sick, and you check your blood sugar regularly, you might want to do it every 4 hours when you're sick. Don't stop taking medications, even if you're not eating. This is especially crucial if you're type 1 diabetic. If you have nausea, don't feel like eating, you can eat some like sick day type foods like ginger ale, regular Jello, Gatorade, applesauce, crackers, any of those things if you're not eating well. Stay in touch with your doctor, especially if you have a fever, you're vomiting a lot, you have a lot of diarrhea, that kind of thing, changes to your vision, or you're just not feeling right. Be in touch with your doctor. If your blood sugar is repeatedly above 250, your doctor will probably want to check your urine or blood for ketones if that happens, because ketones, they're an acid that is left over when your body burns fat instead of glucose. And if you're producing ketones, that means your insulin isn't working to convert glucose to energy in your cells. And high ketone levels can send you to the hospital. They can make you really sick. It's called diabetic ketoacidosis, and it can lead to coma, swelling in the brain, death. So it's really dangerous, especially if you have type 1 diabetes, can be fatal. So just so you know, just take extra special care of yourself. If you have issues with blood sugar, they will probably be a little off when you're sick. And implications of uncontrolled diabetes. So if you don't control your blood sugar well for a long period of time, it can cause a whole range of health problems throughout the body, including damage to the nerves, kidneys, heart, feet, eyes, and teeth, just to name a few. The good news is complications can often be delayed, minimized, or prevented altogether with good control. The key is to having a good understanding of what affects your blood sugar levels, know what important strategies are and tools to manage your diabetes, working with a dietitian, working with your doctor, making a personal commitment. Support from family is really important, and your healthcare team. Learning what you can do is the first step in controlling blood sugar and taking control of your health. Now, the dietitian's job right here, talking about food. So let's talk about diet. But first, I just want to get this out of the way right now, because this is something I come across, I would say, on a weekly basis. There is no such thing as a diabetic diet. Yes, I said there is no such thing as a diabetic diet. Carbohydrates are not off limits for diabetics or pre-diabetics. People with or at risk for diabetes should just eat a balanced diet of healthy foods from every food group. And it's a complete myth that diabetics cannot eat fruit or rice or bread or pasta. Insert any carb here. There are some that are way healthier than others, but there really is nothing off limits for diabetics in the context of a healthy diet, and I'll talk about what that looks like. So foods are made up of 3 nutrients: carbs, protein, and fat, all 3 of those. I've done prior presentations on all of them plus more. So if you want to understand all you need to know about carbs and then protein and fat, I think I went into vegetables and like I dug deep into each of those, but check those out. They're through NorCal. But carbs, so these have the greatest impact on blood sugar. So it is important to understand how to find carbohydrate content in your foods, the foods that you like to eat. Foods that have carbs are mainly starches, fruits, milk, and sweets. So starches are bread, pasta, starchy veggies like corn, potatoes, peas, beans, cereal, and grains. Certain carbs are better for diabetes than others. Foods that are high in fiber are encouraged, like whole grains, whole fruits, whole vegetables, not fruit or vegetable juices, but whole foods. These are the foods that have fiber, which slow down the spike of sugar into the bloodstream. So think of it this way. I like to compare apples to apple juice. So apple juice basically is flavored sugar water. Okay, it tastes delicious, right? But it is apple flavored sugar water, basically. You drink juice, your blood sugar spikes right away, real fast. That's why I tell you to have this in your arsenal in case your blood sugar goes down frequently. This is what you want. Blood sugar goes straight up. So when you eat an apple, you're getting fiber with it, right? The skin is, so when your blood sugar goes up from an apple, this is the fiber slowly. It slows down the spike. Fiber is super important for helping manage blood sugar. It keeps those spikes from just zoom up. It'll slow it down for you. So technical, right? So the foods I talk about that are whole, like whole grains, whole fruits, whole vegetables, they have fiber, which slows down the spike of sugar into the bloodstream. And that's why it's so beneficial. And that's why fruit should not be avoided, especially whole, nutritious fruits. Fruits like sweets, bakery, ice cream, candy, sugar sweetened beverages, especially soda, juice, Gatorade, those things should be limited or avoided because this type of sugar leads to those fast spikes in blood sugar. This is why I recommend, again, to have something like that on hand in case your blood sugar does go down. Very handy for that instance, not so much in day-to-day life. So this is the key right here. This is probably the most important slide when it comes to the nutrition for managing or preventing diabetes. The timing is important. This is the key to improving your A1C. Why is it so important? So think about your blood sugar spikes and dips like an EKG, like a heart monitor going up and down, up and down, up and down. So when you skip your meals, your blood sugar drops. When you eat a high carbohydrate meal, your blood sugar spikes. It's this up and down spike, this fluctuation that is so hard for your body to deal with. The higher and lower spikes, the harder it is for your pancreas to do its job and produce the insulin, the key, and the glucagon your body needs to smooth out the spikes. Glucagon is like the opposite of insulin. It helps you to bring your blood sugar back up. That's the glucagon kit I told you about when you have low blood sugar. So what do? You time your meals and you smooth out these spikes by being really consistent with your carbohydrate intake. So eating close to the same amount of carbs for breakfast, lunch, and dinner will allow your body to regulate your blood sugar a lot easier. Smoothing out the spikes and dips will also allow your medical team to better dose your insulin if you take it or adjust your diabetes medications. When you have diabetes, avoid skipping meals. Try to spread your meals out real even, like 4 to 6 hours apart if you possibly can. It'll give your body a better chance to deal with the spikes and the dips, and you won't have big spikes and dips if you are eating roughly the same amount of carbs per meal. Snacks with 1 carb serving and a protein if you need to have a snack, but don't be afraid to get a little hungry between meals. As long as your meals are evenly spaced and balanced out, it's okay to get a little bit hungry. Regulating blood sugar by timing your carb intake will help with weight loss too, very much so. So keeping your carbs very consistent, spreading out your meals, that will really help you with weight management. How many carbs though? So if you are on the smaller side, then I would recommend 3 carb servings for each meal. That's 3 for breakfast, 3 for lunch, 3 for dinner. For those who are on the larger side, 4 carb servings per meal. So 4, 4, and 4. If you're very large, you might be 4 to 5 carb servings. But I would never go lower than 3 if possible, maybe 2 to 3 carb servings if you're really small. Again, you're going to choose carb sources with fiber. Remember, I talk about fiber so much with the spinal cord injury population because it's so important. It's important for bowel, but it's very, very important for blood sugar control. So let's get to know about sizes, serving sizes for carbs. This is the hardest part of learning how to manage your diabetes, is getting to know this. Once you get this down, it's effortless almost. You will get really good at it. So this is just a small list. There's large lists out there, but basically you're looking for 15 grams of carbohydrate per serving. So any of these is 15 grams. A slice of bread is 15 grams. So each of these on this page is 1 carb serving. So if you're choosing 3 carb servings per meal, that's going to be 45 grams of carbs for each meal, 15, 30, 45. So if you're having a sandwich, I'm already jumping ahead here, but if you're having a sandwich, you're going to have 2 slices of bread, right? So that's 2 carb servings, because 1 carb serving is 1 slice. So that's 2. And then say you're going to throw turkey on that and some veggies and whatnot. Then you have a cup of melon or berries. That's 3 carb servings, done. So you just pick 3 carb servings. And that's just grains and fruit. There's others, and I'll show you. But so basically, if you are smaller, you're going to choose 3 of these 15-gram servings. If you're larger, you'll choose 4. And that is all. So once you get to know the serving size and carbs of your like common foods, then it becomes much easier. Here's starchy veggies and snack foods. So again, each one of these is 15 grams. Each one of these on this small list is 1 carb serving. So again, if you're choosing 3, you might choose one of these things, like maybe a cup of acorn or butternut squash here, and maybe you wanted 3 to 6 crackers there. That's 2 carb servings already. Maybe you're going to have a piece of fruit from the prior page. That's 3. All other vegetables are to be eaten with abandon. Just these are the only vegetables that you really need to worry about spiking your blood sugar. You can eat lettuce until you turn into a rabbit. That's fine. But you do need to count the beans that you're going to put on your lettuce. You need, if you're going to have a baked potato, you need to count that. But these are really the starchiest veggies that you need to worry about counting a serving size for. Just count these in your carb allotment. And then protein. So like I always like to talk about plant-based proteins, but like protein like fish, chicken, meats, eggs, tofu, nut butter, these things don't have to be counted. So as long as it's not breaded or drowned in like barbecue sauce, most barbecue sauce is very high in sugar. So protein and vegetables, and I'll tell you more about that in a second, but here's some dairy. So dairy, there's cow dairy, there's plant-based dairy. You need to count that. And then the sweets and desserts. So for sweets and desserts, they tend to feed hunger more. You may find like, ooh, good, I'm diabetic, I can have ice cream. That's wonderful. Yeah, you can have 1.5 cups of ice cream and still fall within your 3 carb servings. But let me tell you something, you are still spiking your blood sugar. It's not going to be as high as if you ate a pint, which a lot of people do, but you're going to feed hunger more. It can lead to uneven levels of energy. There's no real proven fact that sugar is addictive, but the spikes in insulin and the crashes in the aftermath, they can lead to repeatedly sinking out more sugar. Your body's going to be looking for that quick fix of energy. I don't know if you have ever had a soda or a candy habit, something like that, but it keeps you coming back because your blood sugar goes up and then it crashes and you get hungry and your body's looking for more sugar. It wants more. These foods, sweets and desserts, generally have little to no fiber. You can, like I said, you can technically count them in your carb servings, but it wouldn't be helping you in the long run. So try to keep it to a minimum. Maybe you want to have a nice healthy meal and then your 1/2 cup of ice cream afterwards. So do something like that instead and have a big high fiber dinner and then like a little 1/2 cup of ice cream and enjoy the ice cream, okay? This is another important slide that you should get to know. So labels, get to know your labels. It's preferred that the foods that you eat don't have much easier to eat if you're in their natural state, you know, fruits, vegetables, again, whole grains, but some foods like brown rice and whole wheat pasta and breads, and it's helpful to know how to look at labels and know what's a carb serving for this. So start with the serving size. This example is 2/3 cup. So this is per serving, that's 2/3 cup. Look at the total carbohydrates. So here we have 37 grams of carbs. And then again, remember each serving of carbohydrates is 15 grams. So take the 37 grams here of the total carbs, divide that by 15, and you end up with 2.5 servings of carbs. So if you are a 3 carb serving person, then you probably are getting close there. Then you can like have a 1/2 serving of something else and you're there. So don't count grams of sugar. These are included in the carb total. When looking at foods, again, look at the fiber content. So this serving here is 4 grams of fiber. That's decent. So that's pretty good. Watch for saturated fat. We talk about that. I'll be doing the talk on cardiovascular disease again this fall. Dressing and dressings and condiments, they have a lot of sugar. So make your own maybe if you can, and be honest with yourself. I don't know about you, but like really, who goes into a package and says, okay, I'm going to have exactly 2/3 cup? Be honest, if you're not going to have 2/3 cups, say you're going to have a cup, you're going to need to multiply the carb servings and then divide by 15. You need to do the math. Once you get used to doing that a few times, it gets really easy. And here's a cheat sheet right here. So basically, if you go and use this reference here, carb servings. So say this serving for this meal is 21 grams of carbs. Follow that over, that's 1.5 carb servings, easy. So that will help you. Again, remember the fiber. You probably don't want to eat a food that has 80 grams of carbs because that's 5 carb servings. And for most people, that's too much. And what are you going to have with it? Nothing. Lettuce, maybe a piece of chicken or something, but that's a lot of carbs. So you want to try to keep it reasonable. So what's a meal look like? I'm just about finishing. So you want to start by picking your 3 or 4 carb servings from the list. And there's way more comprehensive lists. I can provide Franklin with a really good resource if you're interested. Choose your 3 or 4 carb servings for your breakfast, your lunch, your dinner. Then you add your protein. So have some protein with most meals, especially if you're trying to work on weight management. Protein kind of keeps you full and satisfied. So you got your 3 carb servings, 4 carb servings, pick your protein, and then you just add an abundance of non-starchy vegetables to the plate. Whatever non-starchy ones are not like potato, corns, or peas, fill your plate with those. And that's a nice, beautiful, well-balanced plate. And that's it pretty much as far as how to manage the carbs. The more practice you do, obviously, the easier it gets. Just keep it consistent. Just remember the EKG and the spikes and dips. You don't want that. You want to stay as close, and it doesn't have to be exact, but stay as close to about the same amount of carbs with each meal, and spread those meals out nice and even through the day, and you will see some amazing difference in your blood sugar control. So this is just an example of a bunch of meals. These are all 3 carb meals. To make them 4 carb servings, you would just add another carb food, or just add a serving of fruit for the meal at the end for dessert. Spread them out nice and even through the day. If you're out and about, like most of my patients, a sandwich and a piece of fruit is like a perfect go-to meal and easy to pack. A snack that you might have if you need a snack in the middle would be like an apple. That's a carb serving, and a couple tablespoons of peanut butter, some protein. So that's pretty good. Once you practice finding the carbs in your diet, learn their portion size, get the hang of getting approximately the same number for each meal, and then adding abundant non-starchy veggies and a little protein, then you're going to make a vast improvement on your health. With weight loss and a healthy diet controlled for carbs, you can reduce the need for medication. In some cases, you can reverse your diabetes altogether. Nutrition is really important in this equation. So you're going to want to talk to your doctor regularly also as you start eating healthier and adjusting your carbs, because chances are him or her, they're going to need to adjust your medications. They're going to need to monitor your progress, because you'd be surprised. You're gonna shock your doctor if you start to manage your carbs like this and improve your diabetes. And I think that's it.
All right. Thank you, Shelley. We have a few questions here. So this person says that they love to cook and they always struggle with portions and how to balance it against what you just presented. What is the best way for them to calculate carbs, calories, and all the stuff that you talked about today?
Well, first of all, I have to say congratulations. If you love to cook, that means you're eating at home, which makes it infinitely easier to eat healthy. I'm a big fan of that. As far as learning to cook, I don't know how complex your recipes are. You can add recipes into a database or something and find out how many carbs per serving they are, and then just divide that by 15, and there you have your carb servings. If you cook in, like, I don't know how to put this, but say you cook brown rice, like that's easy. You can figure out brown rice, and then your non-starchy veggies, you don't have to count those. Like if you're doing protein, you don't have to count that unless you have sugar in the recipe and that kind of thing. It's actually easy once you get the hang of it to figure out what carb servings you have on your plate when you cook at home. It's way easier than going out because the information that we find online for restaurants is not 100% accurate. So, plus that food tends to be saltier, and I talk a lot about salt. So.
Okay, very good. Next question. Cranberry juice seems to be a popular sort of remedy, or at least people use it for particularly bladder infections. What are your thoughts in terms of the type of cranberry juice to use without, taking in too much sugar?
So as far as preventing bladder infections, the science on cranberry juice is kind of weak, but it's thought that there's a component in cranberries that help keep bacteria from sticking to the bladder wall. So drinking cranberry juice, if you feel like it's doing something for you, if it's preventing bladder infections, if it's working for you, 4 ounces is 15 grams. So you can have your cranberry juice. Say you have a 3-carb plan, then have your like a little cup of cranberry juice with your breakfast, and make sure you have 2 other carb servings and call it a day. You can try diet, but I don't know. You can count cranberry juice into a day. It's not a problem.
Would you recommend like frozen cranberry, juice, or versus the off-the-shelf cranberry juice?
Take a look at the total carbohydrates. You go with the lower one. If you can find something that's just cranberries and water or something like that without a ton of sugar, choose something with less sugar if you can. That would be the ideal.
Okay. Next question.
Cranberries. eat cranberry. If you can buy dried cranberries without added sugar, throw that in your cereal. That would be even better. You get fiber with it, and you still get the component that keeps bacteria from sticking to the bladder wall. So go with cranberries.
Yeah, cereal and salads.
There you go. Yep, just count them.
All right, next question. What type of medications could have an impact on diabetes and my sugar levels?
Well, I mean,
especially those that the typical SCI. I think this person is asking their, typical SCI drugs, balcofen,
baclofen, that kind of thing.
Yeah.
Yeah, that's something you're going to need to talk to your doctor about, because everybody is different as far as what kind of reactions they have with medications. Focus on your risk factors. If you feel like you fall into a bunch of those risk factors, including the spinal cord injury, then you probably want to get checked just every 6 months. I would get an A1C and a fasting glucose every 6 months, and keep an eye on it.
Okay. We talked about it a little bit the other day, Shelley. Should individuals with spinal cord injury sort of ask their doctor that every 6 months or so to have sort of blood work done? And the doctor is sort of okay with that? They're welcoming of that?
Well, I mean, this is a preventative thing. All you need to do is show a doctor my slide on statistics and the cost of diabetes in the US. And the sheer fact that you have a spinal cord injury raises your risk for all kinds of metabolic disorders, including diabetes. So if you're over 45, slightly overweight, have a spinal cord injury, have a family history, then it would be the doctor's job to definitely check you and make sure and monitor you closely every year, twice a year.
Okay. Next question. This person has been dealing with pressure sores. You alluded to the fact that diabetes could have an impact in terms of the healing process of pressure sores. Can you kind of expand on that a little bit more?
Yeah, so I don't know if you have diabetes or not, but if you don't, then I would make sure that you don't have diabetes, that your blood sugar is not going too high, because that does impact your wound healing. So if you don't have diabetes, if you do get an A1C and a fasting glucose, everything is hunky-dory, but you have these wounds, then you're going to want to look at your protein intake, make sure you're getting enough protein. Ask for a referral to a dietitian. If you're Valley Med, that will be me. But eat well, eat healthfully, eat lots of fruits and vegetables, a rainbow of color. That will help your wound.
Okay. All right. Tonight was a low question kind of a night. Those are all the questions that we had.
That means I did my job.
You did an excellent job, I think. So thank you again, Shelley. Everyone, as I mentioned, you will have a recording of tonight's presentation in your inbox tomorrow morning, and that way you could refer to it. And also please feel free to share it with family members too. Everything that Shelley shared with you, it's not just for the SCI population, it's really for everyone. And as she mentioned, unfortunately, there's not a whole lot of research and science and data behind sort of in the SCI population and diabetes. So, but she did her best to basically paint a picture of, we're prone to the same kind of issues that the rest of the population has to deal with, and maybe a little bit more. So eat well, just educate yourself and educate your loved ones as well. Thank you, Shelley. And also just one last shout out to our donors who make presentations like tonight's possible. Don't forget, on Thursday, we have Arash, who's going to be doing his cooking demonstration, and he's going to have some summer recipes and dishes to share with you. So join us on Thursday at 5 o'clock California time. There's still time to register to receive the Zoom link for it. Just go to our calendar section, and there's a link to that. And hopefully we'll see you there, Shelley, too, right?
I'll be there.
Okay. All right, everyone. Thanks so much for joining us. Have a good night, and we'll see you hopefully on Thursday. Take care.
Bye, everyone.
Bye-bye.
Thank you.